Question number 1.
Joe was admitted to the emergency room. While Nurse Mimi is gathering client's history, which of the following symptoms the client verbalized Nurse Mimi would suspect for a possible bladder cancer? A. Dysuria. B. Suprapubic pain. C. Painless hematuria. D. Urinary retention. The correct answer is letter C. Painless hematuria. It is the most common clinical finding in bladder cancer. Some people tend to ignore it as they do not feel any pain when urinating. Without microscopic examination, these blood in the urine might not be noticeable. Bladder cancer can happen when you're exposed to toxic chemicals such as cigarette smoke, drugs, and alcohol have the potential to cause defects in the lining of your bladder cells, as many of these carcinogens are stored in your bladder first before you pee them.
Question number 2.
Joe's bladder cancer got worsened and was scheduled for an ileal conduit. Preoperatively, the nurse reinforces the client's understanding of the surgical procedure by explaining that an ileal conduit is A. Diverts urine into the sigmoid colon where it is expelled through the rectum. B. Is a temporary procedure that can be reversed later. C. Conveys urine from the ureters to a stoma opening in the abdomen. D. Creates an opening in the bladder that allows urine to drain into an external pouch. The correct answer is letter C. Conveys urine from the ureters to a stoma opening in the abdomen. So here's an illustration of a normal urinary system. We have the kidneys that produces urine, goes to the ureters which are directly connected to the bladder. However, when a tumor or a cancer grows in the bladder, the urologist removes a short piece of your small bowel called ileum. This will serve as the new conduit for 2 ureters, and then the problematic bladder is then removed. A urostomy pouch is then placed at the stoma that serves as urine collector. This procedure is considered permanent and is no longer reversible.
Question number 3.
Nurse Mimi is assessing the urine output of Joe, who has had an ileal conduit, and notes that the urine is yellow with a moderate amount of mucus. Based on the assessment data, which of the following nursing interventions would be most appropriate at this time? A. Change the urostomy bag. B. Notify the physician. C. Obtain a urine specimen for culture. D. Encourage a high fluid intake. The correct answer is letter D. Encourage a high fluid intake. Mucus is secreted by the intestinal segment used to create the conduit and is a normal occurrence. The client should be encouraged to maintain a large fluid intake to help flush the mucus out of the conduit.
Question number 4.
Nurse Mimi is providing client education to Joe, who had undergone ileal conduit. She instructs the client to empty the appliance frequently, primarily to prevent which of the following problems? A. Development of odor. B. Interruption of urine production. C. Rupture of the ileal conduit. D. Separation of the appliance from the skin. The correct answer is letter D. Separation of the appliance from the skin. If the appliance becomes too full, it is likely to pull away from the skin completely or to leak urine onto the skin. Empty, irrigate, and cleanse ostomy pouch on a routine basis using appropriate equipment. Frequent pouch changes are irritating to the skin and should be avoided.
Question number 5.
Nurse Mimi teaches Martha, who had undergone ileal conduit, to attach the appliance to a standard urine collection bag at night. She also explains the reason behind this intervention is to avoid A. Urine reflux into the stoma. B. Appliance separation. C. The need to restrict fluids. D. Urine leakage. The correct answer is letter A. Urine reflux into the stoma. The most important reason for attaching the appliance to a standard urine collection bag at night is to prevent reflux into the stoma and ureters, which can result to infection. So instead of the urine is stored in the appliance, it drains out to the urine bag collector, preventing reflux to the stoma due to position while asleep.
Question number 6.
Joe, who undergone ileal conduit, will be using a reusable appliance at home. Nurse Mimi should teach the client to clean the appliance routinely with what product? A. Baking soda. B. Soap. C. Hydrogen peroxide. D. Alcohol. The correct answer is letter B. Soap. A reusable appliance should be routinely cleaned with soap and water. Clean with warm water and pat dry. Use soap only if the area is covered with sticky mucus.
Question number 7.
Nurse Mimi is preparing for urinary catheterization of patient Ciara, who was admitted due to car accident. You have observed bleeding at the urethral meatus. Which action has priority? A. Irrigate and clean the meatus before catheterization. B. Check the discharge for occult blood before catheterization. C. Heavily lubricate the catheter before insertion. D. Delay catheterization and notify the doctor. The correct answer is letter D. Delay catheterization and notify the doctor. Bleeding at the urethral meatus is an evidence that the urethra is injured. Because catheterization can cause further harm, consult with the doctor. Urethral trauma can occur due to pelvic and perineal injuries to the urethra.
Question number 8.
Ryan, a male client with an ileal conduit, tells the nurse, "This urinary pouch is embarrassing. Everyone will know that I'm different from everyone. I don't want to go out in public anymore." Based on the client's expression, which appropriate nursing diagnosis is applicable for the patient? A. Deficient knowledge about how to care for the urinary diversion. B. Anxiety related to the presence of urinary diversion. C. Low self-esteem related to feelings of worthlessness. D. Disturbed body image related to creation of a urinary diversion. The correct answer is letter D. Disturbed body image related to the creation of a urinary diversion. It is normal for clients to express fears and concerns about the body changes associated with a urinary diversion. Allowing the client time to verbalize concerns in a supportive environment and suggest that he discuss these concerns with people who have successfully adjusted to ostomy surgery can help him begin coping with these changes in a positive manner.
How many correct answers did you get? I know you got it all correctly, but wait, don't forget to hit on subscribe button and turn on notification bell so that you will be notified for upcoming videos. You can also share this to your friends. Goodbye.